Hi, this is Dr. Scott, and today we're going to talk a little bit about this comorbidity and hearing loss. When you first hear that word comorbidity, you're like, that is a $10 word, isn't it? I know. But here's what what word really means. Comorbidity is meaning there are things that go along together. Okay? So let's give you an example. Diabetes with hearing loss, arthritis, thyroid disorders, vascular diseases, kidney, and falls. All of these things, for instance, you can have kidney disease and vascular disease as well. Those are comorbidities of one another. Each one of these they can actually be together. They can actually go along with one another as well, too. So when we think about them, you can have, I see people with diabetes who actually have increased heart problems, who actually have increased hearing problems, who have increased depression problems. And then we see physicians who are just doping that person up much more dramatically. And then they're getting sicker and sicker. And you're going, I think I know why you're getting worse with that kind of thing too. For instance, my blood pressure was higher as I was heavier. I was 233 about 2 years ago, or well, 3 years ago, and now I'm 194. My blood pressure's right in normal range with that kind of thing too. Well, that's exactly the kind of thing. I needed to lose weight so that my blood pressure would be in the right kind of realm, right? Those who fall, though, we actually see the same kind of thing. Those who fall have a much higher rate of passing away. There's a physician that would tell me all the time, if you fall and break a hip, you are within a year of passing away. And that might sound really scary to you, but the issue of balance is a big problem in those who don't get help with their hearing. Why? Because balance and hearing are sitting in the same general area as one another. You see, the balance system and hearing system actually have the same fluids flowing between them. So those same fluids, if they're not fixing themselves with that, they're not working together, then you're going to have a big increase of problems with fall issues. So while you think that you're fixing it with this, you might be fixing your arthritis with the medication and diabetes or whatever that might be. Are you really fixing your hearing loss with that too? You see, for instance, diabetes worsens hearing dramatically with that, and vice versa. So you start seeing, so a person has hearing loss and their diabetes can get worse because they start noticing that they're not hearing correctly and they're not eating correctly as well. So I see this kind of stuff that becomes a comorbidity, that they become like this, two parts of the wheel, and it just cycles faster and faster and faster. And so you do need to kind of get control of things. One thing to do is to kind of get your hearing checked and find out really if there's something wrong. So get it checked out. Find out if there's something happening. Get it dealt with. Get things dealt with, and kind of see what's going on with your life. Address them. Don't say, I'm just getting too old. It's not something I'm going to worry about. Definitely worry about it. Get it dealt with. Thanks so much.